we feel connected, in that way. We feel like we're doing something, we're reaching out to the community.
When you build connections with people, you're able to better identify their strengths and maybe even some of the challenges.
It's important to kind of be curious and, adjust to maybe what's specific to the community and its needs.
No matter what your rural community looks like, each one has really incredible resources that you can draw on and make the entire community better.
Welcome to the Roots of Wellbeing, where we explore the data, the stories, and introduce you to the people who are planting seeds of change across their communities. Once again, I'm your host, Stephen Cavazos, and you'll notice today we are in a very different setting. This is the Karnes City Methodist Church. Karnes City is about southeast of San Antonio, so we are bringing the conversation on the road once again. And you'll see I'm joined by our subject matter experts for this episode. Let's just go ahead and start with some introductions.
Sure. I'm Dr. Teresa Fenner, and I'm a doctor of public health and a certified diabetes care and education specialist and certified health education specialist, and I work at Otto Kaiser Memorial Hospital.
Awesome.
I'm Patrick Garces. I'm a licensed clinical social worker and the community-based counselor here in Karnes County with Methodist Healthcare Ministries.
Awesome.
And I am Pastor Isidro Pina. I'm the regional pastor actually for MHM, Methodist Healthcare Ministries, which means I do my site visits with the regional staff. We cover 74 counties, and it's a lot of traveling.
Yeah, I was going to say, always on the road, right? Well, I appreciate that we are able to align our schedules to have this conversation as we begin the discussion of reaching rural communities where they're at, but with this lens of behavioral health, the intercession of faith, and bringing those resources to rural communities. So this is a really great conversation, and I always like to kind of open any dialogue up with what we hope people will gain out of this conversation. What do you hope grows out of this? Teresa?
I was just at a rural health conference last week, and somebody said something there. They said, if you've been to one rural community, you've been to one rural community. And I really love that because we're all different. But what I'm hoping people can realize is no matter what your rural community looks like, each one has really incredible resources that you can draw on and make the entire community better.
Bringing awareness to mental health and knowing that even though you're in a rural area, there probably is resources and support there. So just kind of bringing that awareness to access that and also take care of your mental health.
And to me, it's to inform people that how everything's related, faith, body, and mind, and how each one helps the other.
Mm. That's very true, and that's the way that we perceiving that mind, body, and spirit. Right. And I'm really excited to have this conversation with you all. And I like the way that you opened that up, Teresa. When we look at if you've been to one rural community, you really have been to one rural community. This is Karnes City. Patrick, I know you mentioned you were born and raised here. Mm-hmm. I want to first start with, tell me a little bit about the culture here, the community culture.
Well, I think the community culture, first, it's important to point out that there's a huge rivalry between Kennedy and Karnes City. Mm. But either way, I think unity is really big here. So I think a lot of us have grown up here. A lot of us have left and come back because we saw how much unity there is, how much we support each other, but also the need that's here. So a lot of us have left, gotten our degrees, our licenses, and come back wanting to serve. But I think unity is the best word to kind of, describe what goes on here. We, support each other, we cheer for each other, our kids, and all of that. So definitely we're close-knitted, unity, and supportive of each other.
I find that always to be, the case with communities, smaller communities that is, but, thinking about also strengths. Every community does have a set of unique strengths. Mm. What are some of those unique strengths that maybe come first to your mind when you think of this town?
I would definitely say problem solving. And also adjusting. Growing up here and then coming back, we've definitely had to live with a lot of resources without them, and having to travel to just see the doctor and different things like that. So I think we've really adjusted to kind of meeting those needs for ourselves and also growing the community to where maybe we don't have to travel that far out to receive those services.
It's that resilience, right? And when you talk about these services, we're looking at behavioral health. And how long have you been working in this field? And what really got you into that?
Well, so I've been doing social work for about 10 years or so. Clinically, doing therapy, I've been doing it about 5 years. So I went into social work because I wanted to make a difference. I wanted to help people, especially coming back home and doing that here. And then I got interested in mental health because I saw there wasn't a lot of those resources in the rural areas. So I kind of specialized in therapy for family and children. That way I could bring that back home too.
And I think it ties in perfectly to your role at MHM, being a behavioral health counselor. What does that role specifically entail?
Yeah, so I think it's an amazing position. We're here in the community to outreach and provide free counseling to those that qualify that are low income or uninsured. But we're a resource that are kind of put into churches and or different community partners, and we offer the service to those that need it. So it's just a really good opportunity to be able to serve communities.
And there's so many communities that we know across the MHM service area. And I know, Pastor Isidro, you know this very well, looking at the fact that you serve 74 counties. Right. Tell me a little bit about what it's like to provide that pastoral care across the different regions.
Every region is different. Like, for example, if I go to the Rio Grande Valley, the community, the population is totally different from, let's say, Trinity, which is Austin and all that area. So yes, I have to, I don't deal directly with the community. I deal with the staff.
Right.
But the story that I hear from the community, when they deal with people from the community, sometimes they're different. For example, faith in the down in the valley, in the Rio Grande Valley, or the culture is totally different from Trinity team in Austin and Western Hills in San Angelo. So I'm very pleased, happy with the staff because they know how to handle different types of cultures and faith and beliefs, and how they work with each one of them by trying to provide resources, assistance, help, regardless of belief or culture or faith.
Yeah, I think that is also speaks to that from MHM, we look at every area being so unique, having unique strengths, unique capabilities, and also different perspectives that you're gaining across the region. I mean, 74 counties, I don't even know how many towns that is across 74 counties. It's a lot, but you're on the road and you get the perspective through the staff members who, where, they're sharing those stories of experience, which is how you and Patrick obviously, work together in regards to that pastoral care.
Right. Yeah, there's some places, some instances where when I visited with one of the team members, they share with me the lack of resources or other places where resources are abundant, and so it's different every but the way they go out other way to find resources and provide and help those families in need is amazing.
Yeah, I think that's the work that, I'm sure when you're on the road, it's such a privilege to get to see that and obviously hear these stories of impact and share those also with team members across our organization. I want to talk also, Teresa, about your role at Otto Kaiser. How long have you been at Otto Kaiser? What got you into the work that you're doing?
So I've been there, I guess, 4 years now this month. And same as Patrick, grew up here and went off and went to school, and the community does have a way of drawing you back in.
Yeah.
And so there was a grant that our county was lucky enough to receive for diabetes prevention and management in the county. And it really fit in line with some things that I had been doing outside of the community and nutrition education and disease management. And so I just decided to move back home and started working with this program. And it's been incredible because you really do feel so much more of a, I guess, powerful impact when you're back in your hometown and really trying to help the community that brought you up.
Yeah, I think that's what's great is like hearing that, there's this call to come back and serve the community, like you said, that you grew up in, that you are a part of. And I think that's when you really can start to see some of the changes over time too, and just being part of that impact and seeing and hearing those stories, I'm sure is so rewarding. When you look at this community, there's a lot of outreach that takes place. How are you, performing these outreach services? What are we doing to really connect with the community?
Sure. Our hospital, Otto Kaiser, we've been in the community for over 50 years now, and I think that that's helpful to have that mainstay and that name that people know, and it's the central part of the county. It's in the between Karnes City, Kennedy, so there's not
It's
that
a safe
rivalry.
Yeah,
space.
it's neutral.
It's
It's
neutral.
neutral. Yeah.
Neutral ground.
And just having the longevity that we have to where it is recognizable, I think, in the county. And we also have, we're very fortunate at our hospital to have somebody who's in charge of outreach and community relations. And she's done an incredible job at really continuing to build how much our hospital is part of the community and reaching out. And in the last couple of years, a lot of the agencies and resources in the community have gotten together, and we're really able to draw on that. And so I know when I see a need in the community health-wise, I'm thankful that I can reach out to people like Patrick and the Wesley nurse and the health department, and we have these relationships, especially because we're local and we're small and we know each other, and we can build on that and create these partnerships to tackle bigger issues.
It's like this network of resources,
Yes.
right? I think that's fantastic. And thinking about, back to where we are at, right? I know that you mentioned that, being kind of this middle ground, but, being here at the Karnes City Methodist Church, Patrick, I mean, this is another example of how we're bringing services to people to meet them where they're at. Tell me a little bit about how you built those connections between the hospital and then, of course, the church here, and why it's important to be in two different spaces.
Sure. So I think a big person to really mention as well is Megan Martinez, our Wesley nurse here. So she's really laid the groundwork and the foundation to a lot of these partnerships. But I think what's kind of special about the church and Otto Kaiser, the hospital, was that they identified the need that they needed more mental health support and services. So they've been really receptive and just really had open doors. And the church started by reaching out and asking for a counselor to kind of help serve people in the community. But yeah, Megan Martinez has really done a lot. Barbara James is the person that does outreach at the hospital. So I'm glad to have two different spaces, just because, I think there is a lot of importance in spirituality and having faith for your wellness. Some people find that spirituality elsewhere. So there are a majority are comfortable coming to the church, but some also do prefer a more medical setting. Where maybe they feel more comfortable meeting with me at the Otto Kaiser Hospital.
Yeah, I'm curious to know if the needs were, the needs for mental health programs. I mean, what were some of the things that you've heard that people are dealing with? If you can provide any oversight on that.
Sure. I think a lot of anxiety, depression, but above all, just a lot of trauma. Growing up in an area that didn't have the services, we kind of just learned to survive, and we just continued on. It's a very hardworking community. So I think that, we wake up, we, go to work. We also, are there for our families. We support each other. But, at the same time, when we didn't have anything to access, a lot of that can pile up over time. So anxiety, depression, trauma, but just in general, just learning how to kind of keep your mental health really healthy and well.
And then again, being in places, two different places is very helpful. And when I think of community and I think of places of faith, like a church, for example, it is a sanctuary. It's for people, they grew up in the church, they grew up with this familiar setting. And so having a program like this and having the aspect of faith as well, interweaved into that, I think that would make it easier for people to open up and to be vulnerable. And that kind of brings me to a point, Pastor Isidro, if we talk about, churches, they create this safe atmosphere for people. What is it about church that does make people feel safe, places of sanctuary?
Well, in the church, we try to provide some, bring hope, comfort to the people. And also, one of the things that I promote a lot is, seeking counseling is nothing wrong with that. We all need some type of counseling. We see it in the Bible, when Jesus is, I think it's the Gospel of Luke, where there's this guy who's walking around naked, living in a cemetery, and Jesus comes and he sets him free from his problem. And they said he was demon possessed. But my way of thinking is because they didn't know much about mental health back then. So I mean, it happened before in the Bible, so it happens now. So there's nothing wrong with going to find or look for some help. And I am so happy that the church is providing this type of services to the community, not just the spiritual aspect, but also the health and the mind.
And then it ties back to that, the mind, the body, and the spirit, and caring for your whole entire well-being. And I think one of the things that's also important to notice that, with having, pastors at MHM is, being able to have a safe space for also employees as well. I think I also have to throw that out there because that's a great thing.
That's what I do. We provide service to our staff. In my case, I'm the regional pastor, so my ministry is serving the regional staff.
Right.
And we have other pastors in each clinic and then corporate and other offices. So, and they serve other.
Yeah, and I think that's what's, again, we're such a wide service area, but just meeting people, again, where they're at. We're going to talk about regional team members. It's coming to the region, right? And meeting people where they are. And I think what's great is that, while you're out there on your travels is you get to hear those stories and then reinforce, the aspect of faith and caring for your mind, body, and spirit. It's such a big part as we look at, again, just the community well-being. But, when it comes to, building those connections and collaborations, obviously it takes building a dialogue. It takes a lot of work to get to the point of where you're out there in the community, providing any type of service. But you guys also offer a specific type of program, Teresa, the TIDES program.
Yes.
I wanted to know a little bit more about that because that leads us into how you guys are also working together.
Yes. So we established it with part of that grant. Which is we no longer operate under the grant. The hospital has kind of absorbed the program. And TIDES we came up with because we needed a name, and it stands for Take Charge Initiative for Diabetes Through Education and Support.
TIDES.
Yes, so TIDES is much easier to say, right? But it's a diabetes self-management program, and what that means is that we're working with people to take care of their diabetes, so that when they're at home, they're able to provide for themselves and to manage their diabetes instead of constantly coming to the hospital and getting it managed for them. So it's a very empowerment focused type of program, and it's diabetes self-management programs. I mean, they do have high success. It's an established type of program. And so we do diabetes self-management for people who have diabetes, but we also are very large on diabetes prevention. Because about a quarter of South Texans have diabetes, and we really want to keep that at bay as much as we can. So we work with people with one-on-one appointments, and that's part of what we do. But we've also learned that community-based participation and outreach is huge in this community. So I'd say about half of what we do is community programs.
Wow. And that's impressive. One of the things that you also mentioned is the summer programs that you guys offer. And I know that this isn't specifically just focused on diabetes. It's the overall health of a person, which obviously is how you two became acquainted in the work that you're doing, Patrick. How did you guys build and establish this connection? And tell me a little bit about, I don't know whoever wants to take this question, but how those programs are tied into what you guys are doing.
Sure. Well, we started the summer camp program about 3 years ago because we saw that there's some disparities in this community, and one is that there's kind of an income gap, and we do have several children, unfortunately, that live below the poverty line, and summertime's a hard time, when they're not in school. So we wanted to offer something at no cost to families with young kids, and we knew we wanted it to be health focused so that we can prevent some of those chronic diseases like diabetes in the future. But it was also important for us from day one to not just focus on the physical aspect of health, but as many components of general health as we could, including mental health. And the first year or two was we didn't have Patrick available yet because he didn't come along with this wonderful program, and so we tried to incorporate it a little bit on our own, and then last year you came in with curriculum and activities, and it was incredible. And so it was kind of that partnership we already had with Megan, our Wesley nurse, and Patrick when he came in, and it was pretty seamless. And I was so grateful that we could have actual mental health lesson and activities with these kids with you.
That's awesome. What has been the difference that you've seen in these kids since these programs started going on, Patrick?
Yeah, I think definitely the awareness. I think that they're very receptive, and a lot of times, there's not a lot of time in school to kind of learn about mental health or those things specifically. So to be able to have the opportunity, thanks to Teresa and the program, I was able to kind of do that with those kids, and they really take it home. So it maybe starts with the kids and an activity or just a simple lesson, but they take it home and they explain it to their parents. So I think it really helps with the awareness, but also just knowing that the service and the counselor is here in the community to access.
And I think, again, as we continue to drive this point home, it's meeting people where they're at. And that includes kids, meeting them at these summer programs. Again, it may be, someone may enjoy being in this place of a church where, there's a sense of peace, there's a sense of calm and familiarity, as opposed to, there may be kids that are out there and these programs for the community are where they're at. So again, it's just, where we look at these services, it's identifying where the need is and then bringing it to the people. I think one of the things we also talk about, just being in a rural community, I like the way that you frame that, Teresa, is that, if you've been to one, you haven't been to, they're not all the same. What is something that you think people can take away from just some of the strengths of this community?
Sure. All these communities, they're all different. But we all have our strengths, and it's identifying those and building on those. And like y'all had mentioned before, the resilience here is great. And I think part of that is that when we see a problem, we'll find a way to fix it. Even if it's just completely us on our own and we don't have any outside help, we'll find a way to make it work. And so that was something that I think is something we really build upon well here.
And I feel as we are getting a little bit more familiar with Karnes City, with understanding that this is a place where, yes, there are, strengths that exist across different areas, places, and people. And I think that that's also the value of really building those connections, because when you build connections with people, you're able to better identify their strengths and maybe even some of the challenges that they can overcome. What are some of the things that you've been here, Patrick, your whole life, you came back here with those resources. What are some of the value of building those connections that you can share with us, the value of building those connections with the community?
Yeah, I think definitely building those relationships, have them a little more receptive to access services, because they're trusting of the service, especially if they know someone who is the one, I guess, providing it. I think resilience is great, and we definitely found ways to work around things that we didn't have here. But building those connections reminds people that they don't have to continue to kind of do those things on their own, especially if there are services here that we bring that they can access. So I think those collaborations and those partnerships are so important, because we kind of bring that awareness back to now what is available after some time of working, through some of these problems or these challenges. We were able to bring some great resources here. So now people don't have to do that on their own anymore.
Yeah, and I think that's the feeling of not feeling like you're alone in everything. And I think that also ties back into being in a church, Pastor Isidro, not feeling alone. Tell me about the sense of community people feel coming to church. What is the importance of that?
Well, they come to a place where they feel like they belong, they're accepted, and where we try to provide for their needs, spiritual, any type of needs that we can help with. So they come and visit, and we talk, and by the time they leave, they go home with a sense of relief, because every time I visit with the staff, my prayer at the end is always for God to be with them. So when the community, when the people come, the clients, the patient comes to visit, they feel like they've been in the presence of God, so they can go home with that peace in them. And I wanted to say something about the programs that we're talking about. How our department is also trying to help providing for those programs. Our department, we give out like $5,000 grant to each when they apply. And I see a lot of those applications coming through our department, and I can see which ones are going to mental, which ones are going for health, and which application is going for to provide food or something. And we feel connected, in that way. we feel like we're doing something, we're reaching out to the community by having Patrick here in this community. So it's amazing.
It's that extension.
Yes.
It's the extension.
Yes.
And, I do actually want to ask this as well, Pastor Isidro, when we talk about prayer, the power of prayer and praying over people who are doing the work. Tell me the importance of that. I know you mentioned it, but thinking about prayer and how that can really make a difference in people's lives.
Yes, it's incredible. Once again, when I do my one-on-ones, when I do my visits, it's incredible when I ask at the end of our visit, I say, can we pray? Or may I pray? And they're very receptive. And then some of the team members, as soon as I finish praying for them or him or her, they pray for me, and I go home blessed because again, I feel like I was in the presence of God. So prayer gives us a lot of strength, and it brings a lot of comfort. In my conversations with a team member, we talk about personal stuff, work, conflicts, joys, whatever. And that's what, at the end, we pray about those things.
Yeah. I think that when you look at the way that the work is so spread across, it's very easy to feel alone when you're doing the work,
Right.
especially being in a rural community where there may be, different types of, things that you're trying to address, behavioral health being one of them. But having that prayer and that comfort and feeling in the presence of God does provide you peace and also purpose, I would imagine.
Right.
Purpose in doing the work. I appreciate you sharing that. And as we, close out this conversation and we're looking at meeting people where they're at, what is something also that you guys think that other organizations, programs, nonprofits, whomever, what do you all think that is something that they can take away as maybe a best practice?
Sure, I'm happy to start that.
Yeah.
I think creativity is very important, especially in rural communities. You don't have everything just readily available for you all the time. And so you have to get creative to meet people in those spaces. So for us, for instance, with the summer camp, like Patrick was saying, some of these kids, they don't get exposure to things like mental health at school. And, parents don't think to get them mental health, coverage or exposure. And so being creative, so with the summer camp, for instance, bringing the kids to one location and bringing that kind of exposure to them in a fun and approachable way. And so it is, you do have to have some creativity about what resources to reach out to and how y'all can work together to get people together and to get them to be exposed to these types of topics that they may not otherwise think to look into.
Creativity. What about you, Patrick? What is something that organizations can maybe take away from this practice?
I definitely think curiosity. I think that there's a lot of times where things just don't look the way that you hope or you intend. And it doesn't mean failure. You can easily just kind of be curious with it, ask questions, kind of think about why it doesn't work or what could work better. So I think it's important to kind of be curious and, adjust to maybe what's specific to the community and its needs.
That's, I think, staying curious is such a big part of that and it's also reevaluating what you're doing internally, right? As an organization, what can we do better? And maybe, always looking for a way to pivot. All right, Pastor Isidro, what is something you think organizations can take away?
Think relationship and trust, because when I was appointed again to MHM, I had to build my relationship with the staff and trust for them to open up and just have a conversation. And I think I got it. They're pretty open. They trust me. So I would say relations and trust overall.
Yeah, I like that. So, we're talking about creativity, staying curious and building trust and relationships with those that are doing the work. Those are examples of some best practices when we talk about meeting people where they're at in their life journey. And I think, again, specifically in regards to behavioral health, as we are listening to the collaborations that you're building with community partners and also places of faith, that it is about meeting people where they're at. And sometimes we do need those aspects of curiosity, creativity, and building relationships. We really appreciate you guys once again for joining us here as part of this conversation for the Roots of Wellbeing, as we discuss, again, meeting people where they're at and building those connections with the communities. And if you'd like to learn more about the Roots of Wellbeing or the work of behavioral health counselors, you can head over to our website, mhm.org. Just search for the Roots of Wellbeing podcast or Behavioral Health Counselor. We'll see you next time.